All right, hi there. Welcome. Thanks for coming in today. So I just want to talk just a little bit about what's been going on for you lately and why you're coming into the clinic for some help here. So my understanding is that you've been experiencing some TMJ symptoms and some pain in your jaw for some time. So maybe you could just tell me a little bit about your experience there and we can go from there.
I've had TMJ pain for probably about 15 years. It was really excruciating for some time, and I did do some massage and it did alleviate some, but it's still like a chronic pain, always in there, always through my jaw, through here and down here, and then affecting into my neck.
Right.
So I'm hoping we can have some release today.
Yeah, me too. So I think we'll be able to do a good job for you today. So just to qualify more specifically about the level of pain that you're experiencing, you mentioned to me earlier, can you just tell me again on those different regions, what level on a scale of 1 to 10 you're experiencing just in this moment right now?
I would probably be along in here. I can feel the tightness and the pain, and it probably stays about a 6 or around in there all the time.
Okay.
And almost like a burning sensation in there, tightness.
Okay, so pretty uncomfortable. And then up into your sort of your neck and your traps there, where are you at in terms of that level of sensation?
Yes, it comes all the way down, and I'm looking probably about 6 or 7 into here. And then in my shoulder, when I try to use it, it goes from no pain to excruciating pain.
Okay, yeah, so you have some limited range of motion there. And you're also mentioning that you have some limited range of motion in your jaw as well. Like if you go to the dentist, for example, and you have to maintain that open position, that really aggravates your body and you tend to get headaches and things like that. Can you tell me a little bit about the headaches, and can you tell me and maybe even show me just how far you can open your jaw comfortably in this moment now, just so that when we check after the treatment we can see if there's been improvement?
Okay. Yes, if I open my mouth too wide, then it sometimes pops, sometimes doesn't, but causes a lot of pain and a lot of headaches, especially when I go to the dentist and you have to have your mouth open wide for a long period of time. They've always got to put those little forcers in there to get my mouth wide enough. And afterwards I'll have headaches for days. That's about as far as I can go.
Yeah, and then you start feeling some
And
pain.
then I can feel the pain, and they usually want you quite a bit wider than that.
Okay, so we're going to sign off on the iPad here, but we're going to keep the other video rolling, and we'll just check in again with you after. But let's get the needles started here. Alright, so we've already tidied up the points that we're going to be doing today. So I'm just going to quickly tidy myself up here, get nice and clean, and then we're going to start with the needling. So you can just focus on your breathing there, start taking some nice belly breaths in, and we're going to insert some needles here, and then we'll get you to try again those areas of tension, okay? Alright, so we're just going to, you can just help me find some of those tender spots here as I palpate down, just let me know. That's tender there?
That's starting right in there.
Okay.
Yeah.
Alright, so nice deep breath in and out. Okay, we'll find another tender spot along this same line here.
Yeah.
That's tender there?
Yes.
Okay. And you said you've had some acupuncture in the past, so you're not,
Yes.
is that not your first time? Okay.
Yeah.
Great, so we're just
I've
going to...
never been sitting up.
Okay. Yeah, it's different to be getting needles away from your jaw to treat your jaw, hey?
Yes.
Okay, so we're just going to be finding some more tender spots here. Just let me know if we found one.
Yeah.
That's tender there? That was a tender spot? Yeah.
Yeah.
Okay. Alright, so nice deep breath in there. And out. Good job. You're doing awesome. And what's your experience of the needles in the moment? A little bit achy, or how would you describe it? Not too bad?
Not too bad, but I can feel the line along where you're going.
Okay.
But for me, being such a scaredy cat of needles, it's really great.
Okay. So just to find another spot here, just let me know if there's some tenderness here.
Yeah.
That's
You're
tender there?
starting to get into it
Okay.
there. Yeah.
Okay.
Oh, that one.
That's a juicy one?
Yeah.
Okay. Doing great. We're just going to get a few more down below here. we're just going to be actually needling into your leg and a little bit on your foot here. And then we'll do some points in your hand, and then we're going to get you to try again, okay? So let me know, is it more tender just up top here or just down here?
Down.
Down here is a little bit more tender?
Yeah,
okay.
Definitely.
So what we're going to do is we're going to treat your jaw first, and then we'll treat your neck, okay? Okay, so just keep focusing on your breath there. We're going to come around to your hand. Try not to get in the way of the camera here too much. And have you tried any other treatments other than the massage for the TMJ, or just that was
I have done physio and all sorts of things, but
okay.
it hasn't really gotten rid of it.
Right. Okay, so I'm just curious, just in the moment now, if you start to try your jaw, I'm not going to be offended if there's still pain there. We still have some more things we can do, but you can go ahead and just try your jaw a little bit there, and let me know how it's doing so far.
Oh, it is so much more open. Like it's not hurting like it was, the tension and the tightness for sure.
Okay, and in terms, you said before you're kind of at like a 4 or 5 area. Where are you at in terms of the level sensation in your jaw at the moment?
It's funny because I think it's almost gone. I don't know if I'm concentrating on the needles, or what, but it actually feels really, really good.
Okay, that's great. And so these needles here are treating the jaw, and they'll continue to treat the jaw for the next 30 minutes as you're resting there. So I just want you to be really confident that the pain's gone, because like I said, we have some more needles that we can add. If not, if you feel like there is still pain, just go ahead and use your right hand and use just one finger and show me exactly where you're still feeling the sensation.
I don't think I am.
Okay, so you can go ahead and let's test the range of motion there and see how that's doing.
Way better, and it's not cracking
or
wanting to hit that tight spot and then it's going to pop.
Right.
It's not there.
Okay.
That's weird.
Pretty cool?
Yeah.
Okay,
cool.
right on. So now that we've got all the pain in the jaw, like I said, that's going to continue to loosen up. So you're still feeling the trapped tension though, right? Okay, so we're going to go ahead and help you out with that now. So just like before, we're just going to find some tender spots along your forearm here. So just help me out when we hit those spots, okay?
Yeah,
that tender in there?
That's getting more into the tender.
So a nice big deep breath in. Great, you're doing awesome. Just going to get a few needles in here, and then we'll get you to try your traps again. Tender there. Not too bad. Okay. Nothing there. Okay.
There.
Right
Just
there.
hit something.
Okay.
There.
All right. So just keep focusing on your breathing. You hear that tummy gurgle too. That's a nice sign that the body's getting into that parasympathetic rest and digest state, and that's where we do all our real healing and repairing. So that's another effective acupuncture, and probably one you can look forward to, just some more relaxation after. So we're just going to try up top here. Again, just closer to the cubital crease here. So let me know if there's some tenderness. That's tender?
Yeah.
Okay. Okay, so in a moment here, we'll just get this one last needle in, and we'll get you to try your trap. So you can go ahead and roll, not tender there too?
Yeah.
Okay. So you can kind of roll your shoulders, retract your scapula. This should actually get between the shoulder blades as well. So you can go ahead and test out those areas and see if you're still feeling
That's so
pain
much
there.
better. That is so much better. Wow.
Yeah, so how, you said, I can't remember where you were at on your pain scale before. Was it 6 or something?
Yeah.
7 almost?
Yeah.
And where are you at now when you check into that area?
It's it's pretty loose.
Yeah.
It's pretty good. Like maybe down to a 2, if even that.
Okay,
Like
so we
it's
might.
just right down there.
Okay, so we might be, and if you even just sit a little bit or kind of sit up a little bit and retract your scapula, how about between the shoulder blades there?
Yeah, that's so much better.
Yeah.
I've been trying to do the stretches where you lay down and stretch your arms out, and I can't.
Yeah.
And now it's really good.
Yeah. So in turn, I'm not going to be offended, but where are you at, sort of in with your level of pain there currently?
Right down.
Okay.
It's right
To
down.
a 0, you'd say?
Yeah,
Okay. And how about up on the top part of your traps there?
it's gone.
It's gone? Okay, perfect. So, what we'll do now, and we've already got two of your concerns, and I said that we might be able to get your shoulders as well. So I know it's a little bit funny to move your arm with the needles in, but you should actually be able to, and I can maybe help you with this. You were saying that you get a limited range of motion, you can start to feel pain there. So what we're going to do is we're going to get some needles going down below, and hopefully we're going to find that that's going to help with the shoulder pain too as well, okay? So you can focus on your breathing there again, find another tender spot down here.
Yeah.
That's tender?
Yeah.
Okay. So nice big deep breath. And tenderness there?
Yeah.
Okay. Alright, so I'm just going to help you lift your arm there, and we can try. Was it the overhead or just even lifting sort of laterally like that you would get pain?
More up.
More
not-
straight up?
Yeah.
Okay.
Oh, it's gone. I can't believe it.
Is it
like,
gone?
Because that was bad. Really, really bad. Like,
Yeah.
I couldn't lift it at all.
Okay.
Oh, that's crazy. I can feel it in this.
Yeah, you can feel some sensation. So that activation or the ditchy, or the sensation that is in your